Hello, Porter. This is our monthly video series with Tom and me, and we are today acknowledging and remembering the last year since the start of the COVID pandemic. Over the past year, we've witnessed incredible courage, resiliency, and adaptability among all of our employees. And we want to thank each of you for all that you continue to do to care for our community during an incredibly stressful year. So we wanted to take a few minutes to recognize what we've accomplished in the last year and celebrate the work each of you has done.
We'll start with our hospital care providers, nurses, physicians and advanced practice professionals, respiratory therapists, physical therapists, occupational therapists. You did a wonderful job anticipating and learning about the virus, its symptoms, its course of illness. You had long shifts with many PPE changes. Rapidly changing protocols for testing, cohorting, triaging visitors. It seemed like every day we were learning new things. We created new care areas for overflow. Fortunately, we did not have to use them all as we prepared to care for the sickest patients in the event of a regional surge. We'd like to recognize our lab staff for the huge increase in the volume of testing, handling specimens for COVID testing with changing protocols, also providing support and training for clinical staff in many areas to reduce the number of patients that had to come to the hospital for blood draws.
We had incredible work done by our infection preventionists and our education department. They worked collaboratively with physician and nursing leaders, both at Porter and across our health network, to establish and update screening and testing algorithms. They deployed and educated staff about new and changing PPE requirements. They rounded in all care areas to assess for best practices and provide feedback to staff. They also provided direct education around patient care, new algorithms for treatment of our sickest patients, and helped prepare for the case of any sort of surge or ICU level care that we would need to provide here at Porter. We'd also like to recognize plant operations. They did an incredible job of increasing filtration within our care areas, installing UV air treatments. They provided negative pressure rooms for multiple different areas and deployed a tent and drive-through testing sites. They also, if you all remember our cocoa hut that was at the front of the driveway to the main campus, they staffed that for weeks at a time to help patients navigate our campus. And they also were the repository for many donations from community members.
We'd like to recognize our staff of Helen Porter Rehabilitation and Nursing Care. As you watched the news as the pandemic unfolded and saw the great tragedies that occurred in other long-term care facilities as COVID swept through those facilities, our staff kept our most vulnerable patients and residents safe and well cared for during the length of the pandemic. We are among the very first in the state to adopt restrictive visitor policies that was instrumental in keeping communities spread out of our long-term care service. Our staff in Helen Porter spent very many long days in PPE, had frequent COVID testing, and each day, to the best of their ability, maintained safety and vigilance in caring for our residents. We'd like to recognize environmental services and laundry. There obviously an increased demand for services with the new clinical protocols and new safety protocols for infection prevention that they had to manage with each day, and frequent changes in products and learning those new products when supplies were low when our supply chain was interrupted.
We have tremendous respect and appreciation for our team in materials management. They had to procure a large number of gowns and gloves and masks when the supply chain was incredibly unstable. It was a daily and hourly frustration, I think, for many weeks trying to get what we needed so that we could safely care for our patients. They manually counted and tracked every single piece of PPE so we knew exactly what we had when we were getting low, and they aggressively pursued new acquisition of PPE, as well as cleaning supplies and materials for all of our different areas. They also sourced fabric and notions and made gowns when we were incredibly short on gowns. Our pharmacy team has been an incredible support throughout this entire pandemic. They helped evaluate and create protocols for new therapeutics, including monoclonal antibodies, which help keep our most vulnerable patients having a reduced risk of hospitalization. They also have been providing ongoing support to vaccine clinics, drawing up thousands of doses safely and without waste.
Our ambulatory care clinics and staff were also great heroes during the past COVID year. In the spring of last year, we quickly pivoted from our care model of our patients coming to us going to them, adopting telemedicine and creating new care pathways to make sure that folks who needed to be seen were seen. We also created a hybrid model of care where we had staff who would rotate between presence at home and a presence in the clinic to be able to provide for that staff and maintain our staffing model in place for our ambulatory clinics. We even managed to create a new clinic, a very critical clinic during the our experience in COVID in the last year, our acute respiratory clinic, or the ARC as it's more commonly known, to care for those patients with respiratory symptoms, both here on the campus of the hospital and on the campus of our Middlebury Clinic. Our radiology department did a great job in triaging the studies that could be pushed back. And then once we were able later in the calendar year to reopen up to care more on the campus, again, did a process to make sure that we would get those folks whose care had been deferred back into receiving the types of diagnostic testing that they needed to have for their care. Our radiology department also helped care for the sickest patients from day one of the pandemic.
We are so appreciative of our team in nutrition services. They were able to figure out both how to safely provide food to all patients across our campus, as well as to our staff who worked at the hospital, despite needing to update our requirements for physical distancing and spacing in a small space in our cafeteria. And we really appreciate all that they've done to advance that work over the past year. Our finance team has been incredible. They were very diligent in tracking all of our COVID-related expenses and pursuing loans and aid money that was available for COVID relief. And they also worked really hard with our ambulatory settings to establish and track reimbursement for telemedicine and televideo visits. Our human resource team did incredibly flexible work. They helped support work from home for all types of employees. They handled needed for time off related to either COVID exposure, COVID illness, or with all of the employees who may have needed additional time and flexibility to care for their families. They also, in the most acute phase of COVID, managed a flexible labor pool in order to assist staffing in multiple clinical areas.
Our information technology staff was instrumental in enabling us to transition many of our departments that could work from home to that environment and being able to work from home, in providing resources and support to enable that change in our work process. Information technology also deployed iPads for patient use and resident use so that we could maintain interaction with families and friends during the visitor restrictions that were prevalent throughout the whole course of several months. IT also supported the telehealth visits that enabled our clinics to continue to see patients in the outpatient setting, and we even sponsored those telehealth visits in our Helen Porter setting also. Our patient access center. Our patient access center had to handle much increased calls related to schedule changes, COVID triage questions, and requests for testing. Later on, as we were emerging from COVID and we're starting to roll out the first rounds of vaccinations for healthcare providers, they managed that outreach process and the schedule for getting our healthcare providers both on our campus and in the community scheduled and receiving their vaccinations.
I'd like to say a very specific and deep gratitude expression for employee health, which, as you all know, is a single person here at Porter, Liza Eddy. Over the course of the last 15 months, she's worked tirelessly to evaluate our staff's symptoms, get people tested, both targeted testing based on exposures or symptoms, as well as random testing. She did contact tracing and made many follow-up calls. She made herself available to employees, managers throughout the pandemic and worked tirelessly to keep us all safe. She also rapidly vaccinated our healthcare workers with very little notice and with the help of many willing employees who took extra work to accomplish our vaccination goals. And I'd like to give a special thanks to our community. We saw from the very early moments expressions of both assistance and gratitude. They donated masks, they donated meals, they helped create hand sanitizer when we couldn't get any. They adapted to different ways of receiving care. And most importantly, they stayed home, they stayed safe, and now they're getting vaccinated. So we really couldn't have done it also without the support and collaboration with our community that we care for.
So Dr. Benvenuto and I appreciate you taking time to view this video today. In it, we tried to express specific activities for many of the health system departments at Porter that played a role in the past year in our COVID readiness, care, and response. And we recognize also others may have played a role. Just know that we're grateful for all, because it's been a challenging year, and we have really done good work for our community. And we're going to turn to start celebrating that with our annual celebration days as an organization. We have National Nursing Home Week and National Hospital Week, the week of May 9th through 15th, and National Nurses Week, May 6th through 12th, which starts, of course, with National Nurses Day on the 6th and culminates on the 12th on the birthday of Florence Nightingale. We hope that you join us in those weeks to celebrate through different activities we have planned, and as we continue our return to our new normal and celebrate how we care for our community one person at a time.